Hello and welcome to the Kid Knowledge Institute podcast from Amsterdam. I am Bipasha van der Zijde, and today I am joined by Chantal Al-Lakis and Harry Coleman. This year, KIT joined forces with the Gaza Health Initiative to address the rebuilding of the Gaza healthcare sector, which has been decimated over the last months. Both Harry and Chantal are on the committee organizing this conference. Welcome. Chantal, let's start with you. Tell us a little bit about yourself and this initiative.
Hi, Bipasha. My name is Chantal Al-Lakis. I am from Lebanon, and I'm working as an epidemiology advisor here at KIT for a few years. I have been on a project on mental health in Palestine, and I've been working on multiple projects related to the region. We feel very strongly about the cause and the decimation of the healthcare system in Gaza, and this is why we joined forces with the Gaza Health Initiative. To tell you a bit more about the initiative, this initiative started organically with different activists and diaspora and also medical professionals who wanted to support the healthcare system in Gaza. It all started, as I mentioned, very organically. So people started jumping and joining a WhatsApp group, and from there, this initiative was born. Initially, it was rebuilding the Gaza healthcare sector. They do believe that health is the first casualty of war, and this is very true. So for this initiative, when they came together, they started a series of conferences. And these conferences' objectives were around supporting, of course, the system. It was based also on a report that they put together to show where the health system was before the war, what is happening now during the war, and what should be happening after, hopefully, a ceasefire.
You attended the first conference in the series of 3 that was held in Amman, in Jordan. We'd love to hear your impressions from the conference.
The Amman conference took place back in February of this year. It was under the patronage of His Majesty King Abdullah of Jordan, and it was attended by over 400 participants representing regional and international, private, educational, and non-governmental organizations. There were various sessions in this conference, but one that stood out is the Voices from Gaza. This session was facilitated by different people, doctors, and other health professionals who were themselves in Gaza and worked and seen what was happening. And very well-known speakers, amongst them Dr. Gazan Abu Sitta, who is a very renowned Palestinian-British plastic and reconstructive surgeon, very specialized in war trauma, who worked in the region and is actually from Gaza, and Dr. Yusuf Abu Rish, who is the Secretary General of the Ministry of Health in Gaza.
Tell us about some of the voices from Gaza that stood out to you.
The most important key takeaway from these voices or these speakers was that they were people from Gaza or people who have been in Gaza. So it was a testimony of what was happening and also efforts of these people on how to move forward and how to rebuild. There were a lot of presentations on the numbers, the stories. There were people called in from Gaza and from the West Bank to join and share their experiences, which I can tell you changed the tone of the room because of the heaviness of the situation over there. But this is why we're doing this, and this is why the Gaza Health Initiative is pushing to have an agenda or concrete action steps on how to rebuild and reshape the health sector to make sure that we can move forward once we are able to. What I took away with me from all the testimonies and voices and the messages and the pictures that were shared during the conference is the level of destruction, the level of death, the level of malnutrition, lack of access to food, lack of access to water. The situation is very dire and very extreme, with a lot of kids talking about wanting to die because they lost their parents or close family members. We heard in these voices the amount of mental health support that these people will need to continue, in addition to what we've seen as the resilience, because the doctors are, and not just the doctors, we tend to talk about doctors when you say medical, but it's also the nurses, the midwives, the public health workers. working day in, day out, the ambulance drivers, the rescuers, they are still there. They are still working and trying to support their communities and their people.
One of the outcomes of the conference in Amman was the Amman Declaration. Could you tell us what this declaration is and who signed it?
The aim or the purpose of this declaration was to bring together all the people that were there, all the organizations that were represented, international NGOs, private organizations or private institutions. A lot of educational institutions also were there. So everybody who was there supported this declaration. The Amman Declaration emphasized the need for a holistic approach to rebuilding the Gaza health system. It has clearly stated that the health system is an interconnected network. If one part falls, the whole set of the system is dismantled and is prone to failure. Another very important point about the declaration emphasized also the importance of Gaza-led initiatives. We have to remember that there's a lot of indigenous knowledge and a lot of local workforce that we need to support. The declaration insists on a coalition of governmental and international NGOs working in harmony with the Gaza leadership. This is important because this approach will ensure that the rebuilding process is resilient and sensitive to the local needs and conditions that will foster a sustainable and protected healthcare future for Gaza. I wanted to add that it is very admirable how much it was done in so little time. The Gaza Health Initiative is purely people volunteering their own time and their own efforts and, of course, their own networks to find a way to connect Palestinian people, Palestinian efforts to global actors that can support these initiatives. So I just wanted to add that there's a lot of people who believe in the cause of supporting Gaza in this humanitarian crisis.
Thank you, Chantal. Now we go to you, Harry. Welcome to this podcast. Would you like to introduce yourself?
Thanks, Bipasha. My name's Harry Coleman. I'm an advisor here in the Health System Strengthening team here at KIT, and I'm also involved in our Center for Health Systems in Fragile and Conflict-Affected States. I was lucky enough to go to the second Gaza Health Initiative conference in Beirut.
So this conference in Beirut was organized with the American University of Beirut. What was the goal of the conference?
The conference was called Justice for Gaza, the role of international law in protecting health, education and civil society amidst conflict. So one of its purposes clearly was to convene experts in international law about what scope there is for intervening through international legal frameworks in order to protect human rights and the right to health. Aside from that, the conference also featured many people who are currently or have previously worked in Gaza. So I think, again, it was to give voice to these people and shine a light on what's currently happening, the kind of reality of life in Gaza at the moment, and to advocate for support and a ceasefire.
What were some of your key takeaways from the conference?
So one of the key takeaways was simply that aside from a ceasefire, the people of Gaza don't need solutions, certainly not from the outside. In the face of destruction, they are already rebuilding hospitals and health centers. They've in fact reopened parts of Al-Shifa Hospital after it was raided and destroyed. So they're repurposing what resources they have. There's no innovation necessarily needed from outside. It's simply support for a ceasefire and support for the work that has already started in terms of rebuilding. It was just striking the number of Palestinian people who were speaking at the conference who were just coming from working in Gaza. There were health workers, administrators, journalists, many of whom had lost friends and family recently in the conflict. And now they were speaking very practically on a stage in Beirut about what's needed.
So KIT is organizing the next conference in Amsterdam. You've already said that they need support more than anything. What does that support look like? And what do you think will be discussed at this conference?
So with two conferences now, or organized by the Gaza Health Initiative, they would like to move towards funding for the Palestinian NGOs and its network and increase the support, start leveraging their networks to support those NGOs. And the Amsterdam conference is part of that. The title is Uniting Knowledge, Resources and Solidarity. So you can hear from the title, the resources, both technical or financial. We would like to bring together some of the NGOs who are working on the ground and European and global organizations that would like to support. There is a large degree of solidarity from civil society, both in Europe and elsewhere. And many of these organizations don't know how they can help apart from through the established international mechanisms for emergency and humanitarian action. So the event now is about convening all of these players to see if there's ways to coordinate and organize this support in the most effective ways. In terms of what I think the conference will focus on, we're currently working on the program. It will be looking at the phases of recovery of the health system from the current emergency period that it's in, into a phase of transition and eventually into a phase of rebuilding. And we'll be looking at different components of the health system in terms of service delivery, access to medicines, health workforce, and also some governance and finance, and how priorities change as the health system moves between those different phases.
You mentioned a lot of terms like service delivery, and could you unpack some of these terms? What do they actually entail?
Service delivery in this instance means how are health services currently being provided in Gaza, and that will be refined even further, potentially to look at things such as the delivery of mother and child health services during this time. There are thousands of women who are giving birth or who need to give birth still in a under-resourced health system. As Chantal mentioned, there is a huge and hidden burden of mental health needs, which probably isn't being treated at the moment, but will need to be treated long into the future. And the general basic emergency service delivery, how is that currently being organized and how can it be supported? It's not helped by things such as the blockade, which stops humanitarian aid coming in. So we'd be interested to hear about how can organizations help to make sure that these essential services continue.
What kind of organizations should join this conference?
I think we're interested in the kind of range of humanitarian or development organizations. Those who already have a presence in Palestine, of course, would be a priority. That would be combined with Palestinian NGOs who are in the network of the Gaza Health Initiative. And then we hope to bring in organizations who do not yet also have a presence in Gaza, but would like to support. They have international networks. They have ways of mobilizing during emergency situations. We would like academia, experts, technical and financial partners, multilaterals, really anyone who's concerned about the situation and would like to help and has a legitimate means of helping.
And how can they join the conference?
And for anyone who's listening who would like to know more, you can visit the website of the initiative, the Gaza Health Initiative, or you can go on the website of KIT, that's kit.nl, and you can find more information on the conference we're hosting, and also you can follow our social media.
And the bottom of the webpage, there is a link to a form to partner with us, or if you would like to suggest speakers, contributors, or even if you would just like to attend, you can indicate your interest and tell us a bit more about yourself through that form. So we would love to hear from you.
Thank you, Bipasha, for having us today.
Thank you so much, Chantal and Harry, for joining KIT Institute's podcast on the Uniting Knowledge, Resources and Solidarity Gaza Health Initiative Conference. As you've heard, following the first conference in Amman and the second in Beirut, KIT aims to broaden the support available for healthcare professionals to rebuild Gaza's decimated health system through this third conference. Thank you very much for tuning in and listening to the KIT Institute podcast. Join us next month for the next episode. And in the meantime, follow KIT Institute on LinkedIn or KIT on Facebook, or sign up for our monthly newsletter on our website, kit.nl.